And so it's very important, as I showed on that graph, right? We see that as men progress stage 1, stage 2, and stage 3, right? We see 1 in 2 men are no longer having sex, 1 in 3 men have erectile dysfunction, and 1 in 4 don't even enjoy sex that much because of their lower urinary tract symptoms. And I think we need to do more research on stage 4 and 5, especially. I mean, it's frightening to me to think about. Obviously, it's really hard to have sex with a catheter in your penis. Of note, interestingly, there are reports of guys, you can put a Foley plug, wrap your penis back onto your, wrap the Foley catheter back onto your penis, and then put a condom over both to allow for penetration with a catheter. I mean, that's very extreme, but it has been reported. And what we're seeing, once again, that progression from a fractional approach to a maximal approach, we're able to say, look, as you, with fractional approaches, we're able to do a better job of preserving ejaculation and erections. And I think that's the general message. Once again, one size doesn't fit all. Working with your urologist, presenting what are your preferences and values, making sure you're using diagnostics to hear what are the preferences and values of the bladder, and then looking at the resources in your healthcare system and the expertise of your urologist. And that's going to help you navigate how to preserve your sex span, how to maximize your bladder span.
Yeah, that's great. Another question that came in here. Earlier surgery for BPH will have a better outcome. And I think that's kind of where you were alluding to, right?
Absolutely. I kind of showed that slide. There's actually a couple other slides, but I didn't want to go too deep into the academic hole. But yeah, so we showed that earlier intervention, there's a Flanagan study, a randomized prospective trial showing, yes, earlier intervention, that decision first to intervene is important, but also intervening earlier is important. And we saw that diagram of the window of curability, right? We want to intervene before the onset of damage or before the damage is irreversible. And good news, just like at the AUA 2025, there are some great abstracts looking at, hey, about 66% of guys who receive deobstruction who have preoperative stage 3 urgent incontinence, about 66% of those guys can see resolution of their urgency incontinence, which is really important.